but there's a lot going on in medicine. So I thought if I prepared content that what not to miss, no matter what level, what experience you have as a PA, an NP, a physician, doesn't matter. Because sometimes we get a little like, oh yeah, I've seen that before. But if you haven't seen it in forever. So some of these are focused on things that are high risk but low volume. And I'll be the first to own it. I do a lot of reading and a lot of preparation for not only teaching classes, updating lectures, but taking care of patients. And I'm like, aortic aneurysm guidelines. When am I supposed to get a CT? How big is it? Right? What am I supposed to do next? And I work in cardiology.
Negative deflection. A positive deflection is looking at your QRS complex. So if your QRS is mostly positive, then that's your thumbs up. If your QRS is mostly negative, that's a thumbs down. Okay, so look at that QRS complex to determine if it's positive or negative. The important things are we're looking at leads 1 and 2 to start with. So if lead 1 is positive, then you look at your lead 2. If lead 2 is positive, remember, then that's normal axis. What does normal axis mean? Well, we saw the range during which that occurred, but if we think about this big circle, if we have a line here that's going straight across, it starts at least if you were looking at the screen, 0, and then it's going to go 30, 60, 90, 100, 120, 180, and then the other direction, negative 30, 60, 90, 120, 90, 120, 150, 180.
We've got Miss Brown, who's a 23-year-old female with a past medical history of depression and anxiety. She's brought to the ED by EMS. She was found to be at home. She was attended by her boyfriend, several pill bottles next to her. History of depression and anxiety. She's on amitriptyline and Xanax, daily alcohol use, lifelong non-smoker. And again, her blood pressure shows that she's a bit hypotensive at 89/50. O2 sats 94%. Pupils are dilated, mouth is dry, GCS 5. So we're thinking overdose. We're seeing somebody who has got respiratory depression as a result of that. So our ABG, what are we thinking? Respiratory acidosis. She's got a PCO2 of 71.